TRAM flap, transverse rectus abdominis myocutaneous flap. Introduction. The TRAM flap is a type of autologous tissue reconstruction commonly used for breast reconstruction following mastectomy. It involves transferring skin, fat, and muscle from the lower abdomen to the chest to create a natural-looking breast. It can be performed as a pedicled or free flap procedure, depending on the vascular supply. Indications: breast reconstruction after mastectomy, correction of congenital or acquired breast deformities, patients with sufficient lower abdominal tissue for flap harvesting, preference for autologous tissue over implants. Contraindications: insufficient abdominal tissue for flap harvesting, significant comorbidities, e.g. uncontrolled diabetes, cardiovascular disease, smoking or poor vascular health, risk of impaired healing, previous abdominal surgeries compromising vascular supply, obesity or morbid obesity, increased surgical risk. Procedure: 1. Planning, preoperative imaging and flap design. 2. Harvesting. The TRAM flap is raised from the lower abdomen, including skin, fat, and the rectus abdominis muscle, with its vascular supply, inferior epigastric vessels. 3. Transfer. The flap is rotated or detached and reattached to the chest. Free flap procedures require microsurgical anastomosis. 4. Shaping. The flap is sculpted to resemble the natural breast. 5. Closure. The donor site is closed, often incorporating an abdominoplasty. Advantages: provides a natural look and feel to the reconstructed breast. No risk of implant-related complications, e.g. rupture or capsular contracture. Simultaneous abdominoplasty, tummy tuck, enhances abdominal contour. Long-lasting results with autologous tissue. Disadvantages: longer operative and recovery time compared to implant-based reconstruction. Donor site morbidity, e.g. abdominal weakness. Risk of hernia or bulge at the donor site. Requires significant surgical expertise, especially for free flap techniques. Complications: flap necrosis due to vascular compromise. Abdominal wall complications, such as hernia or bulge. Hematoma or seroma formation, infection at donor or recipient sites. Prolonged wound healing, especially in smokers or diabetic patients. Fat necrosis in the reconstructed breast. The TRAM flap is a reliable and effective option for breast reconstruction, offering natural results but requiring careful patient selection and surgical expertise to minimize risks.